Good afternoon, and welcome to my Friday message, and welcome to November. This time of year brings many reasons to feel grateful, but cold and flu season is not among them. This fall has brought the potential for a perfect storm of viral activities: COVID, the flu, and respiratory syncytial virus, or RSV. You might have heard this referred to as the triedemic, and we don't know at this point how much each of these viruses will circulate and when, but we're seeing earlier than usual activity in influenza and RSV. While all three are serious, they present different risks depending on age, vulnerability, and vaccine status to the relevant pathogens. RSV, for instance, is especially worrisome to parents of small children who might be at risk. And later in this message, I'll talk with one of our Duke experts to find out what all of us need to know about RSV. But first, a brief COVID update. According to the CDC, at the end of last month, only 2% of U.S. counties had a high level of COVID-19 in the community, 22% at the medium level, and 76% at a low level. And the great news here in North Carolina is that for the first time in quite a while, the map is all green. In fact, we are one of just 5 places in the states that have all the counties at a low level, including California, Delaware, the District of Columbia, Hawaii, and South Carolina. However, we still have 65 patients in our health system with COVID nevertheless. And the data continues to show that completion of full vaccination recommendations, which includes boosters, markedly lowers your risk for significant disease and death. But we aren't letting our guard down just yet and are watching a few trends in COVID variants and data from other sites. While hospitalizations and deaths remain low, positivity rates have climbed in some areas of the U.S. and globally, and there's an increasing presence of newer Omicron variants, particularly BQ1, as shown in this graph, so we need to continue to watch closely. We are, however, experiencing early signs of a significant influenza season. The Southern Hemisphere, which predates and predicts our flu season, has indeed experienced a significant influenza season, and the CDC tracking shows that influenza is starting early in our hemisphere. Unfortunately, the highest levels of activity are in the southeast and south central areas of the U.S. As you see by this map, North Carolina is classified as high influenza activity. Early data suggests the vaccine is a good match for the circulating flu variants, but it's still too early to fully predict the match, and we'll continue to monitor the data. The CDC's Flu View website is a great way to follow the data, and the address is shown on the screen. Influenza presents challenges in a number of ways. We need a healthy workforce to be able to care for our patients and our communities, and many of those we do care for are at risk for significant disease. The best strategy to remain healthy in this respiratory virus season is make sure your COVID and flu vaccinations are complete, which does include COVID boosters, and receiving this year's influenza vaccine. And of course, stay at home if you are feeling ill with respiratory symptoms. Our flu vaccine uptake is not where it needs to be at this point, so I hope you will all spread the word by using the Zoom background you see behind me. It was shared in our clinical operations update on Tuesday, November 1st. I want to remind you that completion of influenza vaccination is required for all those that do not have a formal exemption by November 15th. As I mentioned, there is another virus on everybody's mind right now. That's RSV, respiratory syncytial virus, and particularly a risk for young children. So to learn more, I talked with Dr. Mike Smith, professor of pediatrics and chief of our division of pediatric infectious diseases. Well, hi, Mike. Thanks so much for joining me today. I was particularly interested in talking to somebody that both has an expertise in infectious disease and pediatrics because of what everybody's reading in the news, which is this concern that we may have at least a triple demic or a triedemic of at least 3 respiratory viruses, one of which I think people are not as familiar with. So we talk a lot about COVID, and we're kind of trying to predict what will happen this winter. Influenza, but also respiratory syncytial virus. So I wanted to start with that. If you could just kind of give us a brief description of what RSV is and who's at risk for RSV.
Yeah, thanks so much. So RSV, I think for those of us who do pediatrics, is something with which we're very familiar. It's kind of a common right, of childhood, and something that most of us in our pediatric residencies have seen. Now, typically RSV occurs kind of mid to late fall to early spring. And it's something that is a common cold in older kids and adults. But if you get it in your first year of life, particularly, and specifically for children who are born premature and smaller, or children who have chronic lung disease, it can cause significant problems and progress to bronchiolitis. So most children with RSV do okay, but somewhere between 1 to 3% of all children, especially in that first year of life, especially preemies, get admitted to the hospital.
And so what should parents look for? Obviously, during cold season, kids have a lot of overlapping symptoms.
Yeah, and as a peds ID doc working in the hospital, I'm lucky that I can test for different viruses to find out what's going on. And actually, my own son had influenza last week, so all these things are out here. I think if you're at home, as a parent, all these viruses that you mentioned, COVID, influenza, RSV, can kind of give you cough, runny nose. If you have a little one, again, especially if they're premature in the first year of life, really make sure that they're breathing comfortably. A little cough's okay, a little runny nose is okay. But if you see any color changes, if you see them, not eating or drinking as much as they normally do, and then kind of what when I'm teaching medical students or residents, kind of say tugging, that working extra hard to breathe, that's really the warning sign that you need to bring your child to seek urgent medical care.
And you can test for RSV, right?
Yep, there are tests for RSV. We've just been talking about this. We don't have a take-home test like we have for COVID yet, but most physicians' offices can test and give you the result pretty quickly.
Well, you mentioned you got influenza from your child. I got COVID from my grandson, but we all got through it. When you think of prevention, obviously vaccines come to mind. Is there an RSV vaccine?
Yeah, great question. There is not yet a licensed RSV vaccine. There are several promising candidates out there. Some potentially to be given to infants, some potentially to be given to pregnant women, but those aren't ready to go yet. So what we have now is a monoclonal, and I think a lot of people didn't know what monoclonals were, but because of the last 2 years, they do now. So if you are the parent of a high-risk infant, again, particularly premature, particularly chronic lung disease, your child may qualify for palivizumab, or Synagis is the trade name you might be more familiar. And that's administered once a month during RSV season. Now, again, we used to know when that would start, and we'd often start November. In the last couple of years with COVID and the pandemic, RSV season started July last year. It started August this past year, and really has ramped up in the last month or so. So if your child is premature, please check with your physician to see if they're eligible for that. Just like for COVID, it won't prevent infection, but it can reduce the risk of hospitalization.
Well, that's really good to know. Unfortunately, RSV is not the only circulating respiratory pathogen that certainly kids can get. We have COVID and we have influenza. So briefly, what are you thinking about those two viral pathogens in terms of risk for kids this season?
Yeah, it's interesting when you look at the epidemiology. Actually, last week, the number of positive tests for RSV was exactly the same as it was for COVID here at Duke. Now, a lot of people are testing at home, so COVID is probably still more prevalent. I think the big difference between those three viruses is that we don't have an RSV vaccine. We have a COVID vaccine that's safe and effective. We have influenza vaccines that are safe and effective, and both the influenza and COVID vaccines, reduce hospitalization. I will say here on the pediatric side, we've had fewer admissions with COVID than we have on the adult side, but we do have a fair share of COVID admissions. We have had at least one child sick with influenza A in our intensive care unit. So children are certainly susceptible to influenza. And just a reminder, everybody, please get yourself vaccinated and your kids vaccinated.
And can you remind everybody who's eligible for COVID vaccination?
Yeah, so actually both for influenza and COVID, if you're 6 months or above, you can be vaccinated.
Can you get them both together?
Yeah, great question. Absolutely.
Okay, well, that's a great message to end in. And thanks so much for joining me today, Mike.
Great, thanks so much.
So if you can leave with one message this week, it's please complete your COVID vaccinations and get the seasonal flu vaccine. If you're relatively healthy, these things may not impact you directly, but they definitely will help protect our health system employees and those at risk for significant disease. And one last thing before I close. The Culture Pulse survey is now open, and I'm asking everyone to take 3 to 5 minutes to take the survey. We want to hear directly from you. Your voice tells us where to focus our efforts. It helps us preserve what's going well and adjust what we could do better. The survey is in your inbox now and will remain there through November 16th. Every opinion matters. I'm looking forward to hearing from you. Thanks, everyone, for tuning in, for all that you do, and have a great weekend.